Hey all you cool scouts and scouters, welcome to another video from the Scouts BSA Rank Advancement Series put on by the Chattahoochee Council. I'm your host Chris, and today we're going to take a little bit of time to dive into something that's important for all of you. It is one of the 10 Scout Essentials, so you need to know this. It's all about first aid kits. Are you ready? Let's go get some bandaging. So before we get started with what is inside the first aid kit, let's take a look at the three different types that I have here. You have a very personal, small first aid kit, very minimal with just the basic necessities. And here we have a standard size first aid kit that I would recommend for you to carry on all outings when you're out of doors. Remember, this is one of the 10 Scout Essentials, so be prepared. And then lastly, for larger groups, you notice this one's a lot bigger and it's a little more extensive. It has some things in here that you're not going to need on a regular basis, but for large groups and especially high adventure and backcountry camping kits, this one's called the Backcountry Kit from Adventure Medicals. They have a great amount, a great selection to cater from the personal level all the way up to the large group and troop settings as well, and one for your home. It's always good to have one in the home as well. So if you don't have one, we're going to talk about some basic stuff that you need to have in your first aid kit. And here you see we have the contents of a standard first aid kit, and we're going to go through and explain a little bit about each one. So we'll start with the bottom here. An ABD pad, which is a giant 5-inch by 9-inch gauze pad. So if you have a large wound that you need to keep covered once you get it sterilized and cleaned out, the AB pad is a great source for that, as well as gauze sponges of different sizes. We have some here and we have some smaller ones here. Those are great to make sure that your wound gets dressed after you've cleaned it properly and applied your triple antibiotic ointment. Instant cold packs are very nice to have, especially for small sprains and things like that. You hit your head and you've got some swelling, you want to relieve the swelling a little bit. Instant cold pack works great for that. We talked about the importance of moleskin, of course, and moleskin is great for relieving blisters and helping keep your feet healthier when you're out hiking and everything. And then we have a couple of different styles of bandages, all the way up from just a standard style, all the way down to the fingertip bandages. Those are very important, especially if you cut yourself, if you're whittling or something like that. It's a little bit more catered to the design of your fingertip. And then we have a couple of these gauze strips, so if you have a cut that's actually kind of spread open, you can actually help close that back, and that way it keeps as much dirt and everything out as possible. So some cool things like that. Then we have gloves, of course. We want to make sure that we wear gloves anytime you're helping somebody else, and especially if there's blood involved. Bloodborne pathogens, you want to make sure you have your gloves to keep yourself sanitary. Tongue depressors. Now there's a couple of different uses for tongue depressors. Now obviously, its name, you can depress the tongue if someone swallowed something and you need to look inside to see if you can clear their airway. But also, say you break your finger or you sprain it, you can actually cut this in half, use this as a splint, and keep that finger straight until you can get to medical help. So a couple different uses there. Obviously, tweezers are going to be a major thing, pulling off ticks, pulling out splinters, all those sorts of things. And then a little bit of gauze tape. Now gauze tape also has a few different uses. Mainly if you have a wound, like you're using an ab pad or a sponge, you can actually wrap that to keep it in place, keep it immobilized. Going back to the tongue depressor and the sprained or broken finger, you can use that, wrap that around and keep it immobilized until you can get medical help. And then we have some gauze wrap, which again, if you have a large wound, you can actually wrap that around your arm and keep the bandages in place so that they don't move and so that it stays clean. We've got some Q-tips here. And Q-tips are very useful as well for applying antibiotic ointment. You don't want to necessarily open this up with your bare hands and then start pouring it on, because you may have something on your hands that can get on this package and then can get in your wound and cause infection. So these are wrapped up individually and sterile. And what sterile means is they're clean. So anything that is inside the wrapper is considered sterile. If that wrapper is opened for any reason, it is no longer sterile and you should not use it, especially on cuts and wounds where you could transfer bacteria into the wound and cause infection later. And then some of your first aid kits are going to come with antibiotic ointment as well as burn cream. So a couple of each of those. And then some of them also have some small medication in there. You need to check with your Scoutmaster and make sure it's okay that those stay there. But we have some aspirin and some non-aspirin, and that's a pain reliever, fever reducer. And then some of them actually have these new Medilites, or they're basically electrolyte tablets, so that if you're dehydrated or you're suffering from heat exhaustion, you could take those along with plenty of water to help get back to normal. So that's the basic stuff that I would recommend adding to your first aid kit. If you guys have any questions, I'm going to put a list up at the end of this video to give you a better idea of what I carry when I go backpacking. It also helps that all of your stuff typically comes in some sort of organizational method, and you can do this on your own. You don't have to use what comes in it when you buy the first aid kit or make it. You can individually have little bags that, one, help keep them sterile even more and protect them from dirt as well as damage, but also in the event you need them, they're already ready to go. You can pull out one bag instead of having to pull apart your entire first aid kit. Now, I did forget to mention the alcohol prep pads. So alcohol does help clean any type of instruments, especially like if you needed a safety pin to pop a blister. You can sterilize it with that alcohol prep pad, or heat from, say, a lighter or some other heat source. And then again, I want to put all of these bandages and things that I may use on a regular basis in one bag. That way I'm not hunting and searching for things in the event an emergency comes out. Now, I would like to point out some really cool things about the larger group kits that may be of interest to you or your unit later on. So especially for fractures and things like that, a lot of them come with these SAM splints. And what it is, it's a rigid but bendable piece of foam that you can actually use to splint pretty much anything. Your arm, your foot, if you got a sprained ankle. There's some pictures there, you can kind of see that. Let's see. And I'll put a link again in the video for you to see some of this cool stuff. But lots of gauze. These are non-sterile gauze, so it's mainly for fractures and sprains. But then when you get into actual wound care and things like that, we do have some triangle bandages as well as some stuff that is actually sterilized. And then for larger wounds, you've got iodine scrubs to make sure that you clean that wound out really well, as well as a lot more ab pads and some larger pieces of moleskin, again for blisters. And then you also have, sometimes you have some syringes, so you can use this to irrigate a wound. Put water in here, clean water, and flush out the wound, and that's going to get the bacteria and dirt out of your wound so you can clean it properly. And of course your burn cream. Again, we got lots of little trinkets that can be added to yours, but also a roll of duct tape. Because just like with the SAM splint, you can use things like gauze and gauze tape to immobilize, but you can also use duct tape for a lot of different wounds as a last resort. Make sure it's clean, wrap it up, make sure that you put something between this and your skin, otherwise it's not going to be fun taking this off. And then of course for bleeding and CPR, we want to make sure we have a face shield. Those are important, especially for bloodborne pathogens, as well as your gloves and antibacterial hand wipes, as well as lots of ab pads and gauze pads. And then it just rolls right up. Fits in someone's pack. Now this is a lot heavier, a lot bigger, takes up a lot more room, but for larger groups, this is something that you want to take a look at and have on hand. You don't have to have it all in one, so you can spread this weight out through multiple members of your group and kind of share the load. This weighs maybe 5 pounds, and this one weighs less than a pound. And then your very basic one usually doesn't weigh much at all, and it can be as simple as a Ziploc bag with a couple of different things in it. I want to see your first aid kit. Show me in the comments on this video on Facebook. Let's tag the Chattahoochee Council BSA and hashtag Scout Skills CC and I want to see what you've come up with for your basic first aid kit. Some of you guys are going to actually have to do that for your rank advancement, so let's see them. Let's see what you got. I hope you've learned today. We'll see you soon. Goodbye, Scouts. All right, Scouts, thanks for tuning in. If you like this video, hit the thumbs up button. Be sure to subscribe to our YouTube channel. That way you can follow all the cool videos that we add, because we want you to learn and we want you to be prepared. On behalf of the Chattahoochee Council, thank you very much for tuning in. Follow us on Facebook, follow us on Instagram. Just follow us, and we'll see you soon.